Stasha was born on the August 2nd, 2002 by a natural childbirth. It was her mother's first neatly controlled pregnancy. Mother received utrogestan and Folnac in the first trimester of pregnancy to treat a urinary infection. Stasha was born in the 39th week. Her APGAR score was 8 from 9, the weight 3.910 kilograms, height 54 centimeters, head circumference 32 centimeters, and bilirubin 129. Until the 5th month, she was fed only by the breast milk. Non-milk diet was introduced during the 5th month. She used to vomit during the first month of breastfeeding. Parents thought it was because of Phil. She was breastfed until she was 11 months old. Breastfeeding was interrupted due to her mother's second pregnancy. While breastfeeding, she often had thrush. She has started to sit on her own when she was 6 months old. She has started to walk on her own when she was 13 months old. She has been regularly vaccinated. Stasha suffered several colds, the first one when she was 5 months old. They were followed by a very stuffy nose, which made it difficult to breastfeed. Acute inflammation of the windpipe and throat gargle appeared. In the first 15 months of her life, she had high temperature for 3 times. Her lungs were always clean. When Stasha was 16 months old, she looked sleepy, but she didn't want to sleep and she behaved normally. She ate less food. She inclined the neck to the left. It lasted for 15 days and disappeared without any treatment. When Stasha was 19 months old, inclination of the neck to the left reappeared. She seemed sleepier and her left eyelid was half closed. She played, but she was not happy and she ate poorly. She communicates and is aware of. Bulb visibly goes sideways and upwards. When Stasha was 20 months old, her condition drastically became worse. There was a constant drowsiness, expressed tremor of the whole body with difficult walking. The first hospitalization was at the University Children's Hospital Tiršova, which has undergone CT scan. She was discharged home after only 1 day with the proposal to visit neurologist. When Stasha was 21 months old, symptoms become more severe and the condition has become even worse. She has started to bend her head and whole body tremors were more pronounced. The child could not walk independently anymore. Different recordings and testings were done, and all results were normal. Only acid which returns to the esophagus was diagnosed, and as a therapy, she has started receiving Nexium. On September 11, 2014, she received immunoglobulin and introduced dexazone, after which she straightened her head, raised the eyelids, and walked. She was good for a month, but the symptoms reappeared again. Highest pressure she had was 150 with 110, and that is why she has started receiving Carulex, which replaced Calcort. She still has high pressure. She has difficulties in defecating. It happened that she was not defecating for 2 or 3 days. The longest period was for 15 days. As a therapy, she received syrups, teas, powders, but they were not effective. The stool was hard. In December 2014, she did not urinate regularly. The longest period was for 31 hours, so they helped her with the catheter. Stasha still wears diapers, and she does not say when she wants to wet, but she says after urination and asks to be changed. She twitches one of her legs while sleeping, but it takes only a few seconds. In March 2015, she started to speak indistinctly. She held her eyes barely opened. She was drooling, like every time when she holds her head to the side. She was scratching, and the blood pressure was 130 with 80. In January 2015, they included PEG in her therapy.
Hajde popni si na krevet da vidi mama nešto. Popni se srećo.
It happens that her right eye does not blink. Sometimes, when it blinks, it is followed by the blinking of the left eye, but it is slow. This characteristic is accompanied by the onset of the disease. In one period of the disease, she used to bite, and as a consequence, there were wounds, and therefore she started receiving nipple. It still happens sometimes, but far less often and periodically. After a warning of parents, she stops biting. She had talked normally, composing sentences till the appearance of high blood pressure. She knows the songs by heart, repeats the words she hears on the television. When she wants something, she asks it from her parents. While she was taking corticosteroids, she was sweating a lot. Now, she sweats when her blood pressure is high and when defecating.
Mama te slika, ajde, dok hodaš. Dobro, dedo.
Sleepiness is the longest symptom. It appears periodically. When her condition is stable, she does not look sleepy. As soon as the condition worsens, sleepiness returns. She becomes weak and feeble, and she doesn't hold her head straight. Now she spends most of the time in bed, lying on her stomach. She seldom wants to walk while someone holds her hands. She rarely plays, and she is nervous because her younger brother upsets her when he grinds his teeth and sucks his finger. She feels upset, but she has not got any tears. Currently, she is receiving treatment: Nexium 10 mg per day and Carvilex 6.25 mg a day.